Starting? Am I talking first?
Yeah. Go ahead, you're live.
Hi guys. So we're trying something new, and we're going to try to do some go live Facebook things that and addressing some topics. Sorry, close my door. And so this will be something new, and if it works well and if we have interest, then we'll do this more often. So at the end, if you guys want to comment on how you liked it or other topics that we can talk about. So today first we wanted to talk about infertility. I thought this was a good one to start out with, and knowing that we probably aren't going to get a lot of people following right as is our first time, I'm just going to go ahead and talk a little bit about infertility first. But if you have questions as time goes along, feel free to comment, and Sam here is helping me hold my phone and read my comments, so be nice. And she will read off questions that you guys have as well that we can try to address. First though, when I think about infertility or just even conception, I just want to let those of you that are struggling with this know that we know the heartbreak and how hard it is, and we know the pit in the stomach that you have that nobody else can see, and we get that, and we feel for that, and we want to do everything we can to help fix that for you. So the basics of fertility. And I know this is something we probably should know, but we don't, and I get that as well. And I have a little handout here, a little poster to kind of go through this. And so when you think of fertility, you've got to think of what does it take to make a baby. So first, you have to have sperm, and you have to have an egg, and you have to have a place for the two to meet. All right. So when you start thinking about problems with conceiving, you break it down to each of those topics. It's really funny to me that so many women will go straight to the gynecologist when they can't get pregnant, when 50% of the time it's their husband's fault. But that's okay, we'll take that. We as women usually take that on as our responsibility. So at some point we will end up sending your husband, presumably for semen analysis and trying to check that out. So when we talk about sperm problems, just some basics about this. We're not going to get too in depth on this, but there's obviously a problem with the number that they make. There's a problem with whether they're swimming straight or swimming in circles. There's a problem sometimes with just whether they can actually penetrate an egg. And all of those things can be checked. It's a pretty easy check for him, as long as he brings a sample in. And it's something that's pretty easy to rule out at the beginning if there's trouble getting pregnant. The other thing about sperm is to know that men make them all the time. So they might have a period of time where they have a great semen count or sperm count, and then they might have some illness, they might sat in a hot tub too long, something along those lines, and their count goes down. So theirs is a very fluctuating process. And so that's something, if we find it's a problem, of course we send them to a urologist and have them deal with it. But a lot of those problems can be fixed. And sometimes it's a pretty easy fix. And so definitely worth looking into. So as a gynecologist, of course, we're going to work on the next two, which is there an egg? Now, if you are having a period every month and you are pretty regular, there's like a 98-99% chance that you are ovulating every month. So if you're having regular periods, regular meaning every 27 to 35 days, and they're coming every month, you're not missing a month, there's a good chance that you're ovulating. And so then you just have to figure out when and try to time it appropriately for that. If you are going 3 to 4 months between periods, you are probably not ovulating, or if you are, you're ovulating very rarely, which means you might have 3 chances a year to get pregnant. And there's no reason to do a semen analysis. There's no reason to wait the full year, because it's considered 1 year after trying that you're considered infertile. But if you're only having a period every 3 to 4 months, you don't have to wait a year. You're not going to get pregnant. So if that's your problem, jump straight to that. That's when you come straight into us, and we try to fix that problem. And again, something that's usually relatively easy to fix. So that's the one case where we don't necessarily go down the list. We just jump straight to the problem. So let's say, why would you not ovulate each month? Probably the most common and the most popular, I guess, is just polycystic ovarian syndrome. Let's talk a little bit about that. Polycystic ovarian syndrome is common. And by the name, it kind of makes it sound like it's the ovaries problem, but it's really not. It's an insulin problem. And you're not diabetic because your insulin keeps up with the amount that it needs to keep your sugars normal, but you require so much insulin to do that that it actually binds to the testosterone receptors on your ovaries, turns on testosterone, which then messes up everything. It causes you to not ovulate, it causes you to gain weight, it causes you to have acne, hair growth, all of those testosterone things. And so when we try to treat PCOS, usually our first thing is to try to lower your insulin level with like a diabetic agent like metformin, and then of course do ovulation induction. And so that's just a common thing, and it's a frustrating disease because of what it does to your metabolism. And a lot of people say, well, just lose weight. Well, if it was that easy to lose weight, as we all know, we would just do that. And we get that. This is kind of a hurdle to doing that, and the PCOS changes your metabolism so much that that's nearly impossible for some women. So we don't really say that anymore. So at this point, we just try to fix the problem. Other causes of not ovulating, sometimes you've lost a lot of weight or you gained a lot of weight. Sometimes you're exercising too much. Sometimes it's just stress. Other things that can throw off your cycle. Sometimes it's other hormonal problems that will throw off your cycle. But the biggest sign for you if you're not ovulating is you're not having regular periods. So if that's the case, that's the first thing you need to come in for. So let's say you're ovulating, you're having regular periods, and your husband's sperm seems to be normal. Then what could be the problem? Then we start looking at the meeting place, the uterus. So the uterus has to be normal. It has to have a normal shape. It can't have a septum in it. And the fertilization actually takes place in the tubes. So the tubes have to be healthy. If you've had prior infections, that can cause tubal disease. If you have just a malformation because of birth, then that can cause infertility. And these are usually looked at either by ultrasound, or we can do some tubal dye studies, or what we call an HSG or hysterosalpingogram, where we put some dye up in the uterus. We can see the shape, make sure the tubes are open. If that's normal, you also have the cervix. And the cervix is a little bit less well defined as far as the problems. But we know that women sometimes can have an antibody that will actually attack the sperm, so they don't make it past the cervix, or the mucus is so thick that it won't make it past the cervix. And so sometimes it just is a barrier there to the sperm, and we have to fix that. And we usually fix that with intrauterine insemination, where we then take the sperm and put it up into the uterus. And that's a process that we can do here in the office, again, pretty easily, and not overly expensive as far as fertility treatments go. Sometimes we don't know what it is about the cervix or the problems, but we know that when we add the IUI, the intrauterine insemination, it fixes it. And so who cares if we know what it is as long as we fix it, right? The other problem that's kind of in that meeting place is endometriosis. And endometriosis is when the lining of your uterus that you slough off each month grows actually outside of the uterus. It grows on your ovaries, it grows back behind the uterus. It doesn't always block the tubes. You'd think that that would be how it causes infertility, but we don't totally know how it causes infertility. The theory is that maybe it produces some toxins that kills off the embryo, but we do know that even a small amount can cause infertility. And the treatment for that used to be that we go in laparoscopically and cauterize it all off, and that does improve your fertility a little bit to do that. It's usually more for pain, because endometriosis can cause a lot of pain with your periods and pain with the intercourse. But really the treatment that's preferred among the reproendocrinologists, your infertility docs, is just to do IVF if that's the case. But most of the time in our practice, because a lot of people can't afford IVF and they still have pain and they want to fix that anyway and they want to know for sure, we'll often do a laparoscopy, look for endometriosis, clean up as much as we can, hope that that little bit of increase of fertility is all it takes for that. So that's kind of the gist of fertility all in once. I don't know if people have asked questions at all, but one other thing I kind of wanted to talk to you a little bit about here is just what is a normal cycle. So when you start talking fertility, we have day 1, day 14, day 28, and what does that mean, and what are the definitions for those? So day 1 is the first day of any bleeding that you have, even if it's spotting. Because some women will start out when they'll just spot at first, and then they'll go on to a heavier period. Some women will do vice versa or whatever, but the first day of any sign of bleeding is day 1 of your cycle. Now, it's amazing how consistent it is that women ovulate day 14. It's really, for as variable as we all are, it's amazingly consistent. So day 14 is when most women will ovulate. And you can do that, you can find that out by an ovulation predictor kit, and even the cheap ones from the dollar store are fine. But ovulation predictor kit, or you can watch for ovulatory mucus, which is a really clear watery discharge, and it only lasts for about a day or two, but that's an ovulatory discharge. So you can watch for that, because it doesn't matter how well all this stuff works. If you don't have intercourse in the time that you're ovulating, you're not going to get pregnant. So you got to time it right. I've had a few patients that have had ovulation like day 8 for some random weird reason. And the cure was we just had sex on day 8 and they got pregnant. So if you can figure out when you ovulate and have intercourse on that day, it won't necessarily work the first 2 or 3 months. In fact, only about 20% of people get pregnant each month. 20% of fertile people get pregnant each month. But it should work in time. And then for the time from ovulation to the time your periods start can be really variable in women. So that can be 14 more days. It can be 15, 20 days or whatever. That can be a variable time in your cycle. So that one doesn't matter as much. That shouldn't affect your fertility. All right. So other questions. Sam, did you have some?
How common is infertility?
Oh, you probably should have asked me that before. It is actually really common. And like I said, the definition of infertility is a year of actively trying. And so a lot of people, like I say, only 80% will be pregnant by the end of a year. To get pregnant a little longer. So it just takes some time. That is very common. It's very common for women not to get pregnant the first 2 or 3 or 4 months that they try. So I wouldn't panic unless, like we talked about, you're not having periods at all, because then why wait? But otherwise, give it time and let it happen and kind of pay attention to your ovulation. I don't know if I can tell you the exact number of infertility couples out there that are trying, but it's something that a lot of people deal with, a lot more people than you think. So don't think that you're alone. There are people that have babies that you have no idea how hard they work to get those babies. It's not something that people necessarily put on Facebook. but there's a lot of people dealing with it. And because of that, I think we all need to be sensitive when we start asking people, so when are you going to have another baby? Or why haven't you started your family yet? Because you have no idea how much somebody's struggling with that.
Right. We've got something from Tony. Hi, Tony. She says, I have PCOS and have been tested. All hormone levels are normal, but I still had cysts on my ovaries. I have 4 kids and wanted more children. Now I am 43 and doctors refuse to help me because her comment. There we go. Because of my age. But I hear people getting pregnant at an older age is becoming more common.
Yeah, and so you're right. PCOS is something that usually starts in the early 20s, but can come on later. And so I think you're lucky or nice. It's great that you've had 4 kids. And it's probably, again, your insulin levels are getting higher as you've got a little bit more pre-diabetic. That's kind of led to this. The ability to get pregnant, well, first, the normal labs are just that. They're normal. That's a hard thing with PCOS. We don't have a good test that says, oh, look, we do this test and it proves that you have PCOS. It's a diagnosis made by a syndrome. That's why it has the S on the name. It's a syndrome, which means we have all these different things that kind of feed into it, and we say, okay, you have most of these entities, therefore you have PCOS. And so the labs can be absolutely normal when we check for that. But the fact that you have cysts on your ovaries and that you haven't been able to get pregnant. There's a word called fecundity, and it's your ability to get pregnant. And so your fecundity drops tremendously after 40, and particularly after 42. So even when doing in vitro fertilization, where we're doing all the technology we have, the ability to get pregnant after 42 is exceedingly low. And I'm sure that there's probably offices that will do in vitro fertilization after 42. But their success rate is going to be really low and it's going to be really expensive. And so a lot of them will just say it's not worth your money and time to do that. Like I said, you'd have to shop around. I bet you could probably find someone. You look at Hollywood, obviously they're doing it. But just your ability for it to even work is exceedingly low after 42. It's like down in the single percentiles.
Okay, great. Carly's on here with us, and she said, I also have PCOS. I'm not on birth control, and I have broken out so badly on my chin. Is that a part of my hormones being off as well as the PCOS?
Absolutely. Well, it's part of the PCOS. It's the testosterone aspect of it. And birth control works really well for the acne part of it because it does suppress that ovarian hormone, so you're not getting quite as much testosterone. The other thing, I'm glad you mentioned the birth control, because a lot of women with PCOS get frustrated when we put them on a birth control. They're like, we're trying to get pregnant, so why would you put me on a birth control? there's some actually really good studies that show that if somebody's not responding to Clomid, we're not getting them to ovulate because their PCOS is kind of resistant, that if we put them on birth control for 2 or 3 months and then take them off and put them directly on Clomid, they actually get pregnant faster. So faster than the women that just stayed on the Clomid for those 2 or 3 months. And so there's something about shutting those ovaries down and keeping them quiet until you're ready to get pregnant and then going straight to Clomid that is just more effective. It's like you've shut them off and now they're ready to respond. If you're not actively trying to get pregnant right now and you want to in the future, I think it's a great idea to go on birth control as long as you can tolerate it, because I think it's going to suppress the acne. It's going to kind of keep your body ready so that when you do want to get pregnant, hopefully it's faster.
Can hormones from birth control, kind of like when you have diabetes and your pancreas is just going crazy with that insulin, and so it kind of shuts off, can birth control do that with your ovulation?
It's kind of the theory, yeah, that it kind of just quiets it down, gets all of those extra cysts gone. Those cysts all have their own little hormones in it, so sometimes we're fighting those. So it's nice to shut the whole system down for a few months and then restart it, and we actually tend to get a much better response. Even if you're not doing fertility pills like Clomid, often putting on a woman on a birth control pill and having them come off and just try to get pregnant that first month can work better than just, trudging at it month after month after month. So it's frustrating, I know, when we put you on a birth control pill when you're trying to get pregnant, but it actually will speed up your ability to get pregnant in the long run.
We'll jumpstart things a little bit.
Yeah.
And we do IUIs at the Budge.
Yeah.
When do we offer that? Do they have to do so many months of Clomid before?
Right. So what we would offer here at the Budge, and any of my partners will do this, is obviously after the testing, and usually come in for a consult, and we go through your cycles and see if we can figure out if you're ovulating and timing and all of that. If we decide that you're ovulating, or even if you're not, we do Clomid to make you or help you ovulate. Usually I have you do about 3 months where you're clearly ovulating, you're clearly having intercourse at the right time, and then if it's not working, then we say, okay, maybe we need to bypass the cervix, and we do the IUI, and we do that here as well. And I think it's about $400 or $500 around there to do that. And we have an awesome woman, Carrie Sells, who comes in and she does the sperm prep that you have to do, and then we just sneak it up into your uterus, and you lay there for 20 minutes and cross your fingers and hope that those sperm swim in the right direction. And so it increases your ability to get pregnant by about 30% more, and so it's a good thing to do. And 100% if you have a cervical problem that we need to diagnose. But yeah, we do that. When we go on beyond that, behind Clomid and IUI, when you're talking about in vitro fertilization, that's something that the endocrinologists do. And there's a guy that's up here. There's several in Ogden and Salt Lake and Sandy that do that. But that's when you're getting into the $11,000 a month type stuff.
So how many IUIs do you feel comfortable doing before you feel like it's more beneficial for them to go down to a reproductive endo?
And that's a hard question because, and even months of Clomid, because I definitely have patients that will do 8 or 9 months of Clomid. Some of it's financial, and I don't want to waste your money. I don't want to keep doing things that aren't going to work, because by the time you waste a lot of money doing these things, we probably could have paid for an IUI or an IVF. And so that's something we go on to, but usually about 3 months of IUI, and if that's not working, then it's time to at least get a consult from Endo. One of the things that they do that we don't do here either is called a sperm penetration test, and they actually will take your husband's sperm and put it to a hamster egg and see if it'll actually penetrate the egg, because if they can't do that, then you really have to do IVF and actually ICSI, which is a different procedure, but... so they do some more studies. So usually after 3 months of Clomid, you're not pregnant, 3 months of IUI, still not pregnant, then it's time to probably get at least a consult.
Perfect.
And we work with a lot of those guys as far as helping do some things locally so you don't have to drive to Salt Lake every day or whatever. So.
Perfect.
All right.
Yeah, that was great.
Are we out of time?
I think that hopefully we got some good info out for everybody. Yeah. If, we've got one more question. Okay. She said she's been having 2-week periods starting right on time every 28 days. The second week is very heavy and lasts a full week. I have a doctor's appointment, but what would the cause be of these heavies?
Yeah, so that's something more with the structure of your uterus in general. maybe somewhat hormones. The problem is that you're probably ovulating right in the middle of your heavy bleed. So, because you should be ovulating day 14 regardless of the amount that you're bleeding. So you might be missing ovulation because you're bleeding. So that would be something that you're going to have to test on top of that. But it's usually more of a structural thing like a fibroid or just the size of your uterus that's causing something like that, because it sounds like your hormones are working pretty normally.
Okay.
So.
Perfect.
All right, guys. Well, thanks. Again, this was just one topic. We chose infertility this time. We have a plan to do some postpartum depression coming up. But if you have other topics, other things that you want to talk about, message us, text us, comment, and we'll try to get those in the near future. How frequently we do this will kind of depend on the response that we get if people like this. And we'll go from there. Have a good day.